Welcome back to your Feel Good Breakfast Show. It's Expresso right here on SABC3. Now, it is the first day of May and also the first day of National Burns Awareness Month. Now, it's an opportunity for the South African Burn Society to raise awareness around burn prevention during the colder months ahead. And joining us this morning is plastic and reconstructive surgeon Dr. Wagner Smith and physiotherapist Eleonora Lozano, who specializes in burn rehabilitation. So good to have you on the show.
Morning. Thank you for having us.
Great to have you here. I mean, this whole month is dedicated to burn awareness and burn injuries. Dr. Smith, I'm going to ask you, how significant of a problem is burns in South Africa?
Well, the problem is huge. I don't want to bore you this early in the morning with lots of statistics, but just consider this. Every year in South Africa, 1.6 million patients are burnt, and 12% of that actually are fatal. So that makes for a huge mortality rate or death rate of almost 9 out of every 100,000 patients being attended to. And the commonest cause still up to today in the century we live in for children under the year or under 4-year-old is burn injuries.
Wow.
Okay.
That is
those
considerable
are shocking statistics.
Yes.
Eleonora, when it comes to how to prevent these injuries, what should we be implementing, whether it be at home or at work?
So some of the suggestions is, as Van has explained, like our toddlers and our children are most at risk. They're explorative in their nature and they have no fear or sense of danger at all. So when you're cooking, you have your pots and pans, your handles should be turned in, your kettle cables and all those things should be out of reach, because otherwise
they're going to pull it down.
Yeah, absolutely. Yeah. When in the instances of when you're running your bath or you're preparing the hot water bath, put the cold water first and then go and put the hot water. You end up using less water that way as well, but then in that instance where you're preparing it, you're not leaving the hot water unattended. Things like your matches and your lighters should be kept out of reach. Care with candles, so making sure that they're blown out and not left unattended. So some of the strategies.
It's scary, like these incidences happen so quickly. And Dr. Smith, I want to ask you, from your experience, what is the most, the mechanism for injury? What's been the mechanism or the easiest way for people to have been burnt?
Well, the commonest cause in South Africa is still hot water burns or scalp burns, as we call them. But it differs from city to city, from province to province. As a whole in South Africa, we actually have about 37% of patients injured either by assault with fire or hot water thrown onto them. Wow. 20% of these are accidental. 15% is due to shack fires or your informal housing burning down. 6% only to electrical burns, and only luckily 2% of industrial burns or chemical burns.
Okay. Well, as we heard, there are some shocking statistics around burns in South Africa and how easily it can happen to you or to the ones that you love. So when we come back after this, I want to get into what happens after you are burned. What is the next step? Because I think that's maybe where the problem gets exacerbated, the lack of knowledge on how to actually treat it at home once it happens. So we're going to get back with our experts, Dr. Wagner Smith, that's here, and also Eleonora Lozano, and they're going to be giving us more information, so stay tuned.
It's my Feel Good Breakfast Show.
Well, today, as we said, is the first day of National Burns Awareness Month, and joining us in studio to chat more about this and, of course, enlighten us who are not so familiar with this topic is plastic and reconstructive surgeon Dr. Wagner Smith, as well as physiotherapist Eleonora Lozano in studio. Now, before we left the last segment, I wanted to know what happens if you do get burnt. What is the next step that you have to do immediately?
So first and foremost, you have to stop the burning process. So whether that can be from fire, so practice your stop, drop and roll, immediately get that fire out. Or if you see someone who's on fire, get a blanket and just help douse the flames. Or remove that child or that adult in that hot water situation, get them away from the burning process. And then immediately cold running tap water for 20 minutes.
Water for 20 minutes.
20 minutes. It seems a very long time, but it's just, the point is to minimize the effect of the burn. Things that you shouldn't be putting on the burn is no ice, no butter, no toothpaste.
I was about
all
to
the
ask
things what we're supposed to do.
Like baking powder, none of that.
None of that,
None
please.
of that.
So just running tap water.
And then
no foundation. We've heard horror stories. Jensen Violet, mercurochrome, none of those things. Literally just running tap water. And at that point, cover it with some cling wrap or cling film, or if you don't have that, a dry, clean towel, and seek medical attention. Get yourself to the hospital, the clinic, for further assistance, but running tap water.
Well, Dr. Smith, that was going to be my follow-up question is you've had your injury at home, you've now done the cold running water. What's the next process from that?
Yeah, just to latch on what Eleonora was saying, definitely after that period, go to your GP or to a clinic closest to you or a hospital. That wound needs to be seen by a medical trained person. From there, we will then assess the wound, either in the size or the severity of the wound, as well as the depth of the wound. Now, we judge the size of the wound in percentages of the total body surface area, and 1% of the patient's is 1% of the palm of the hand, is 1% of the patient's total body surface area. Now, as soon as this injury becomes significant, more than 10%, then you will need a fluid resuscitation with an IV line sited and drip running fluids in. And then also to judge the severity of the wound. It can differ from a very superficial wound that is just more than a severe sunburn really, to a full thickness burn where the total skin is burnt off and is charred and becomes leathery. And then, of course, from there, the medical attendant will decide whether to admit the patient, whether it needs surgery from that. We've got certain criteria. Like all children, for instance, under 1 year age must be admitted. All inhalational burns must be admitted. Bigger burns must be elated. Electrical burns must also be admitted.
Okay. Well, you guys often talk about third-degree burns, second-degree burns. Is that the severity of how deep it is when you label it like that?
Yes, we've moved away from first to third or fourth degrees and rather say superficial, and then partial intermediate depth, and then your full thickness. For us as clinicians, it just makes better sense to work it like that.
Makes sense for us.
Yeah. Definitely. Well, the skin is the biggest organ that we have, so it's so good that we're being informed and kind of schooled on how to take care of ourselves. But when we come back, I want to find out what goes into reconstructive surgery of the skin. We've got our experts here, Dr. Wagner Smith, as well as Eleonora Lozano, and they're giving us all of the info as to what to do as we kick off National Burns Awareness Month.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. This is Expresso. Hope you're enjoying your Workers' Day, but today's also the first day of Burn Awareness Month, and we have plastic surgeon and reconstructive surgeon Dr. Wagner Smith and physiotherapist Eleonora Lozano with us in studio as we discuss some important things that comes around burning and what to do after that's happened. Now, Dr. Smith, we've spoken about, home remedies and getting to, not necessarily home remedies, but what to do at home, getting to the medical practitioner. What goes into reconstructive surgery for plastic surgery for burn victims?
Well, I must say a burn injury is one of the most painful injuries that one can sustain, and so is the process of harvesting the skin to reconstruct as well. So we have to attend to the patient's pain needs as well as nutrition in hospital. It requires multiple surgeries, going back to theatre for changes of dressings. It ends up to being a long hospitalization period, and then you still have to do the rehabilitation as well. And from a surgeon's perspective, there needs to be proper planning. One has to have a sound judgment of what the depth of this injury is to make the right decisions for the patient. Also persevere, it's a long process. And then, of course, luckily we have the help of modern surgical techniques and more advanced medication and dressings to help the patient through this difficult process.
Now, I've heard of skin donations. How does such a process work, and does South Africa have a skin donation organization?
Yes, luckily we do have a skin bank. And correct, for a large percentage burns, we do need donor skin to cover those exposed areas with skin grafts, even if it's just temporary. So we need those skin to save lives. We just not need organ donors, we need tissue donors as well, because even after death, in the case of a tissue donor, one can still harvest skin, cornea, as well as bone from the donors.
Oh, wow.
Please go and have a look at Recycle Me, is a website where you can actually become a tissue donor as well and read more about the questions and get informed. Ek is 'n vel sowel as 'n orgaanskenker en julle.
can now in
Yes, you can.
Well, I've registered.
How?
I've registered organ donor, which I'm assuming also includes your skin because it's the largest organ.
Yeah.
But I did not know about that, and we've got those details on your screen if you would love to read a little bit more. Eleanor, I want to ask you now that we've, it is a long process. It's a long journey to recovery. As a physiotherapist, how long does it take to get someone back to their full mobility after a burn?
So being able to give an exact timeline is actually really difficult because for example, no two burns patients that are 15%, for example, will respond the same way. It can take a period up to 2 years from their initial admission, working through their mobility, through their grafting, things like we have to wait a certain amount of time before we can start moving them, working hand in hand with the occupational therapists, the surgeons, and everybody on board. The other thing is the patient's own motivation is a very, very big factor that comes into play, and how they also, as Van had mentioned, it's very painful, so how they respond to analgesia, working through the trauma of the burn, and as I say, it's very difficult to predict. Someone could be 6 months or not, it can actually take up to 2 years to get patients through. Yeah.
That's crazy. I don't know, do we have one more segment coming up with our experts?
I think we do.
We do?
Yeah.
Okay, wonderful. We're going to take a quick news break. When we return, I want to speak about the emotional and psychological help that's offered after this trauma because, like Eleanor says, it does take up to 2 years to deal with all of this. So we'll find out more from our experts after this. But first, let's catch up with your news headlines.
It's my feel-good breakfast show.
Well, it's time for us to catch up one more time with plastic and reconstructive surgeon Dr. Verida Smith as well as Eleonora Lozano, and they are our experts this morning as we chat about kicking off National Burns Awareness Month. Now, we've spoken about a whole host of things. We're very, very informed right now, but I want to speak about the emotional and psychological aspects of the healing process because it's not just the physical that we need to take into consideration. It is a huge, huge adjustment, and the skin is the first thing we see when we meet someone, and how the health of it really has to affect a patient in a very detrimental way to know that you have to go through this process.
Absolutely, as you've said, it's not just the physical side of things, it's that emotional, it's aesthetic appearance of how the scars look. So managing scars, we have things like pressure garments that we advocate for patients, as well as scar massage. But then we have certain instances where you can have an expressive therapist, psychologists, volunteers that come in and help patients along this journey. So not just from a medical perspective, but there's so many other people on board that help the patients through. And then from a health professional's perspective, you're not one man making a decision. We're a multidisciplinary team. There's so many people in terms of communicating and getting through everything. And we walk the journey with the patients and their families together.
I was about to say it also affects the families, especially given the statistics that so many kids are, victims of burn injuries. Now, Dr. Smith, I want to ask you, how can people get more involved? I mean, we have a month that we're going to be, highlighting burn awarenesses, putting the spotlight on injuries, but how can people get involved that want to get more involved?
I think the essence is prevention is better than cure.
Yeah.
If we start there, we've won the battle at least halfway. En dan help om tragedies te voorkom, moenie tragedies veroorsaak nie en wees ingelig om hierdie beserings te voorkom. En hoe meer ingelig mens is oor hoe om brandwonde te voorkom en te behandel, hoe beter gaan die uitkoms uiteindelik wees. Gaan doen gerus op die Sikelele Impilo Stichting se webwerf en teken aan. Dis notonmywatch.org.za of by www.sikelelaimpilo.org.za vir meer inligting in die verband.
Okay. Thank you so much for supplying that. And I think it's also very important, like you say, for people to become skin donors and to, what is that website that you said we should check out again?
Recycle Me.
Recycle Me. Yes. That's another one
like
that
your
you have to watch.
bottle.
But we've got notonmywatch.org.za currently on your screens right now. I think it's a very important month, and we just have to say thank you so much for coming, informing us a little bit more on, burn awarenesses and injuries and what to do if it happens and the process that follows after that. So thank you so much.
Thank you guys for having us. Thank you.